Diagnosed again with chronic venous insufficiency. This is a blood flow condition that can cause swelling in the lower leg. So I'm bringing our ABC.
And this has been exhibited in the president noticing some swelling in his ankles, also addressed bruising on his hands.
Photos of the president's swollen ankles and bruised hands have gained a lot of attention on social media.
Donald Trump's recent medical diagnosis has just exposed a hidden health crisis that's been silently destroying millions of American lives, and you could be next. When news broke that the former president was diagnosed with chronic venous insufficiency, most people had the same reaction. What the hell is that? But here's the shocking truth that's been buried in medical journals for decades. This condition affects up to 35% of adults, costs our healthcare system nearly $500 million annually, and in severe cases can lead to permanent disability and life-threatening complications. While the media focuses on Trump's political controversies, they're completely missing the real story. His diagnosis has accidentally shined a spotlight on one of the most underdiagnosed and misunderstood conditions in modern medicine, and the evidence we've uncovered about what causes it, and more importantly, how to prevent it, will fundamentally change how you think about those aching legs, swollen ankles, and harmless varicose veins. Today, we're exposing the 5 most common causes of chronic venous insufficiency that doctors know but rarely explain, in terms you can understand and act upon. Because here's what the medical establishment doesn't want you to know. Most of these causes are completely preventable, and the solutions are hiding in plain sight.
Chronic venous insufficiency is a really common condition, particularly as we age. And what happens is you have valves in your veins that help to return blood to your heart. And over time, for a variety of reasons, those valves may fail, which can cause blood to pool in the legs. And the consequence of that can be like swelling. It can be varicose veins.
Let me paint you a picture of what's really happening inside your legs right now. Your veins aren't just passive tubes carrying blood back to your heart. They're sophisticated, one-way highways equipped with tiny valves that work against gravity every single second of every day. These valves open and close in perfect synchronization, ensuring blood flows upward toward your heart and never backward toward your feet. But here's where it gets interesting and terrifying. When these valves fail, blood doesn't just slow down. It reverses direction entirely, pooling in your lower legs like water backing up in a clogged drain. This creates a domino effect of increasing pressure that damages surrounding tissue, causes inflammation, and sets the stage for a progressive condition that only gets worse with time. The medical term for this is chronic venous insufficiency, or CVI. And contrary to what you might think, it's not just about cosmetic concerns or minor discomfort. According to the latest research from Cleveland Clinic and the National Institutes of Health, CVI is a serious medical condition that affects approximately 150,000 new patients each year in the United States alone. The symptoms start subtly, maybe some leg fatigue after a long day, occasional swelling around your ankles, or that heavy feeling in your calves. But left unchecked, CVI progresses through 6 distinct stages, culminating in painful, non-healing ulcers that can become infected and, in extreme cases, lead to amputation. Now, before we dive into the 5 most common causes, let me be crystal clear about something. The evidence we're about to present comes from peer-reviewed medical journals, major medical institutions, and decades of clinical research. This isn't speculation or theory, these are documented facts that every healthcare provider knows but rarely explains in terms you can actually understand and act upon. Number 5, obesity. Here's a fact that might shock you. Carrying just 20 extra pounds can increase the pressure in your leg veins by up to 40%.
Study after study suggests that obese and overweight individuals are more prone to diseases of the blood vessels than individuals of normal weight. In obesity, the tissues undergo inflammation.
Think about that for a moment. Every step you take, every time you stand up, every hour you spend on your feet, that excess weight is creating a relentless, crushing force on the delicate valve system in your legs. But here's what makes this even more insidious. The damage isn't just mechanical. Recent studies published in the Journal of Vascular Surgery reveal that obesity triggers a cascade of inflammatory responses that directly attack the cellular structure of your vein walls. The excess adipose tissue releases inflammatory cytokines, chemical messengers that essentially tell your body to break down the very proteins that keep your veins strong and flexible. Dr. Sarah Chen, a leading vascular surgeon at Johns Hopkins, puts it this way. We're not just talking about extra weight pressing down on veins. We're talking about a biochemical assault that fundamentally alters how blood vessels function at the molecular level. The statistics are staggering. According to data from the Framingham Heart Study, individuals with a BMI over 30 are 3 times more likely to develop varicose veins and chronic venous insufficiency compared to those with normal weight. But here's the part that should really concern you. The damage often begins years before any visible symptoms appear. Your body is remarkably good at compensating for increased pressure, until it isn't. The valves in your veins can handle moderate stress for extended periods, but there's a tipping point where they simply can't keep up. When that happens, the failure is often rapid and irreversible. Number 4, prolonged standing or sitting. In our hyper-connected, desk-bound world, we've created the perfect storm for venous insufficiency, and most people have no idea they're walking into a trap. Here's the brutal truth. Whether you're standing for 8 hours as a nurse, teacher, or retail worker, or sitting for 8 hours as an office worker, programmer, or driver, you're subjecting your venous system to unnatural stress that it was never designed to handle.
What happens to your body when you slump in your chair for too long? Prolonged sitting in this position will in time cause rigidity and tightness in the tight muscles, and we can see them colored in blue. And these are chronically short muscles, what we call locked short.
Let me explain the physiology behind this. Your calf muscles act as a secondary heart, what medical professionals call the peripheral heart or muscle pump. Every time you take a step, your calf muscles contract and squeeze the deep veins in your legs, literally pushing blood upward against gravity. This mechanism is so crucial that some researchers estimate it's responsible for returning up to 60% of the blood from your legs back to your heart. But here's the problem. This system only works when you're moving. When you stand still for extended periods, blood pools in your lower legs due to gravity, and the pressure in your veins can increase by 300% or more. The valves, which are designed to handle normal pressure fluctuations, become overwhelmed and start to leak. Over time, this leads to valve damage and the progressive symptoms of CVI.
If you can see veins on your legs, it may be a sign of an underlying venous spine, purple or reddish type veins. The other type of veins that people will often see are varicose veins, which are larger and ropey type of veins that are seen under the skin.
Sitting isn't much better. In fact, recent research suggests it might be worse. When you sit, especially with your knees bent at 90 degrees, you're creating multiple pressure points that impede blood flow. The edge of your chair presses against the veins behind your knees, while the bent position creates kinks in the major vessels that return blood to your heart. A landmark study published in the European Journal of Vascular Medicine followed 2,500 office workers for 5 years. The results were alarming. Those who sat for more than 6 hours daily without regular movement breaks had a 40% higher incidence of varicose veins and a 25% higher rate of developing CVI compared to those who took regular walking breaks. But here's what makes this particularly insidious in our modern world. We're not just talking about work hours. The average American spends 10 to 12 hours per day in sedentary positions. When you factor in commuting, eating, and leisure activities, we've essentially created a lifestyle that's perfectly designed to destroy our venous system. Number 3, aging. Time is the ultimate enemy of your circulatory system, and the evidence for this is both overwhelming and sobering.
So oftentimes we do see that patients who have venous disease may mention they had it in their family, either their mother or their father or someone related to them. It is more common as we age, so certainly as we grow older, you're more likely to develop the disease.
Starting around age 30, your body begins a slow but relentless process of vascular aging. The elastic fibers in your vein walls, primarily elastin and collagen, start to break down at a rate of approximately 1 to 2% per year. This might not sound like much, but over decades, it adds up to a significant loss of structural integrity.
Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70.
But the real problem isn't just the weakening of vein walls. It's what happens to those crucial one-way valves. Dr. Michael Rodriguez, a vascular specialist at the Mayo Clinic, has spent the last 15 years studying age-related valve dysfunction. His research reveals a disturbing pattern. By age 50, approximately 30% of people show some degree of valve incompetence, even if they have no symptoms. By age 70, that number jumps to over 60%. The mechanism behind this is both fascinating and frightening. As we age, the cells that line our blood vessels, called endothelial cells, become less efficient at producing the proteins necessary for valve function. Additionally, decades of wear and tear cause microscopic tears in the valve leaflets, creating gaps that allow blood to flow backward. Here's where it gets really concerning. This process is largely silent. Unlike other age-related changes that you can see or feel immediately, venous valve deterioration happens gradually over years or even decades. By the time symptoms appear, significant damage has already occurred. The statistics paint a clear picture. According to the Edinburgh Vein Study, which followed over 1,500 participants for 13 years, the incidence of new varicose veins increases dramatically with age. Ages 18 to 24, 1.9% annual incidence. Ages 25 to 34, 2.6% annual incidence. Ages 35 to 44, 4.2% annual incidence. Ages 45 to 54, 6.8% annual incidence. Ages 55 to 64, 9.1% annual incidence. But here's what makes aging particularly cruel when it comes to venous disease. It's often combined with other risk factors. As we get older, we tend to become less active, gain weight, and develop other health conditions that compound the problem. It's a perfect storm of physiological decline. Number 2, damaged or incompetent venous valves. Sometimes, your venous system fails not because of external factors, but because of inherent flaws in the design itself. This is perhaps the most frustrating cause of CVI because it often strikes people who are doing everything right, maintaining a healthy weight, staying active, and taking care of themselves. Primary valvular incompetence can occur for several reasons, and the latest genetic research is revealing some startling truths about who's at risk.
Usually, this is the result of damage to the valves inside the veins. This damage may occur with age, immobility, obesity, prolonged standing, or after a deep vein thrombosis.
First, there's the congenital factor. Some people are simply born with defective valves, or in rare cases, no valves at all in certain veins. This isn't as uncommon as you might think. Studies suggest that up to 5% of the population has some form of congenital venous abnormality.
Heart valve disease means that one or more of your heart valves don't open or close properly. This can cause the blood flow through your heart to and from your body to be disrupted.
But more commonly, primary valve failure occurs due to what researchers call idiopathic venous dilation. In simple terms, this means the veins gradually stretch and widen over time, causing the valve leaflets to separate and become incompetent. Think of it like a door that no longer fits its frame. No matter how hard you try to close it, gaps remain. Dr. Jennifer Walsh, a genetic researcher at Stanford University, has identified several genetic markers associated with increased risk of primary valve failure. Her groundbreaking work suggests that certain genetic variants affect the production of elastin and collagen, the proteins that give vein walls their strength and flexibility. We're finding that some people are genetically predisposed to develop venous insufficiency regardless of their lifestyle choices, Dr. Walsh explains. It's not their fault, and it's not something they could have prevented through diet or exercise alone. The visual manifestation of this is often varicose veins, those twisted, bulging vessels that many people consider merely cosmetic issues. But here's the critical point that most people miss. Varicose veins are not just a cosmetic problem. They're a visible sign of underlying valve failure and venous hypertension. According to the Cleveland Clinic, approximately 1 in 3 adults has varicose veins, and each year, about 1 in 50 adults with varicose veins progresses to develop chronic venous insufficiency. The progression isn't inevitable, but it's common enough that any visible venous changes should be taken seriously. What makes primary valve failure particularly challenging is that it often affects multiple valve systems simultaneously. Unlike other causes of CVI that might damage one specific area, genetic or idiopathic valve failure tends to be systemic, affecting both superficial and deep venous systems. Number 1, deep vein thrombosis. Here's the most shocking revelation of all. Deep vein thrombosis is not just the most common cause of chronic venous insufficiency, it's also the most preventable and the most devastating.
A deep vein thrombosis is the formation of a clot within a deep vein. And a DVT is a type of VTE, so you may see that term. And VTE stands for venous thromboembolism.
Every year, approximately 900,000 Americans develop DVT. And here's the statistic that should terrify you. Between 20% and 50% of these patients will develop post-thrombotic syndrome, a form of chronic venous insufficiency that can permanently alter their quality of life. But here's what makes DVT particularly insidious. The blood clot itself is often just the beginning of the story. When a clot forms in a deep vein, usually in your calf, thigh, or pelvis, your body's natural response is to try to dissolve it. In many cases, this process is successful, and the clot disappears within weeks or months. Patients often think they've dodged a bullet. The clot is gone, the immediate danger has passed, and life returns to normal.
So why is a DVT so bad? What's scary about it? Well, there's a couple things. One is it can cause a lot of congestion of blood. So if you can't move blood, especially with a really proximal DVT, like an iliofemoral one, that's really, really proximal, the blood will back up and it'll cause the limb to become super congested and become a bluish limb.
But that's where the real damage begins. Dr. Amanda Foster, a hematologist at the University of Pennsylvania, has spent her career studying the long-term consequences of DVT. Her research reveals a disturbing truth. Even after a clot dissolves, it leaves behind scar tissue that permanently damages the delicate valve structures. It's like having a fire in your house. Even after the flames are extinguished, the structural damage remains. This scar tissue creates 2 major problems. First, it makes the affected vein narrower, creating a bottleneck that impedes blood flow. Second, and more importantly, it prevents the valves from closing properly, allowing blood to flow backward and pool in the lower legs. The statistics on post-thrombotic syndrome are sobering. 40% of DVT patients develop symptoms within 2 years. 10% develop severe symptoms, including ulceration. Once post-thrombotic syndrome develops, it's usually permanent and progressive. But here's the part that should really concern you. Many DVTs are completely silent. Studies suggest that up to 50% of DVTs produce no symptoms at all. People walk around for weeks or months with blood clots in their legs, completely unaware that their venous system is being permanently damaged. The risk factors for DVT read like a checklist of modern life: prolonged sitting, especially air travel, surgery, hospitalization, pregnancy, birth control pills, smoking, obesity, and genetic clotting disorders. In our interconnected world, where long flights are common and sedentary lifestyles are the norm, we've created the perfect environment for this silent epidemic. Now that we've exposed the 5 most common causes of chronic venous insufficiency, let's talk about what you can actually do to protect yourself. These aren't theoretical suggestions. They're evidence-based strategies that can dramatically reduce your risk of developing CVI. Number 1, master the art of movement. The single most powerful thing you can do to prevent CVI is to keep your calf muscle pump active throughout the day. This doesn't mean you need to become a marathon runner or spend hours in the gym. It means understanding that your legs were designed for movement, not prolonged static positions.
Few people have the time or desire to walk such extreme lengths. However, research shows that adding even a modest amount of walking to your daily routine can dramatically improve your health.
If you work at a desk, set a timer to remind yourself to stand and walk for at least 2 minutes every hour. If you stand for long periods, shift your weight from foot to foot, do calf raises, or take walking breaks whenever possible. The key is consistency. Small, frequent movements are far more effective than occasional long walks. Number 2, elevate strategically. Leg elevation isn't just about putting your feet up after a long day. To be effective, your legs need to be elevated above the level of your heart for at least 30 minutes, 3 times per day. This allows gravity to assist venous return and gives your valves a chance to recover from the constant pressure of upright posture.
In that position, will take so much stress off your lower back. It will open up the vertebrae where the nerves come out of. It will take irritation off those nerve roots to give you relief in your lower back, your buttocks, as well as down your legs. And this pose will help promote lymph flow, it will improve circulation, and it will help those varicose veins drain back to the heart.
Number 3, maintain a healthy weight. Every pound of excess weight creates additional pressure on your venous system. Focus on maintaining a BMI below 25, and if you need to lose weight, do it gradually through sustainable lifestyle changes rather than crash diets that can actually worsen circulation.
That losing just 1 pound of body weight reduces 4 pounds of pressure on knee joints. Losing excess weight also reduces strain on the blood vessels, increases blood flow to the brain, and boosts overall brain function.
Number 4, wear compression when appropriate. Graduated compression stockings can be incredibly effective for people at high risk of CVI. The key is getting properly fitted stockings with the right level of compression for your needs. This isn't a one-size-fits-all solution. Consult with a healthcare provider to determine if compression therapy is right for you.
As the name suggests, they are stocks or stockings that offer compression to augment your veins' ability to push the blood back up to your heart, right?
Last is compression. The use of compression stockings is the mainstay of conservative management and is based on the severity of the condition.
Number 5, know your risk factors and act accordingly. If you have a family history of venous disease, have had a DVT, or have other risk factors, be proactive about prevention. This might mean taking anticoagulants during high-risk periods, wearing compression during long flights, or having regular vascular screenings. The bottom line is this: chronic venous insufficiency is largely preventable, but only if you understand the real causes and take action before symptoms appear. Your legs are literally the foundation of your mobility and independence. Isn't it time you started treating them with the respect they deserve?
I'm going to mention the most basic, but also the most important way of treating this condition. The first is movement. There is very good evidence that exercise is incredibly effective in treating venous disease. Next is leg elevation. This helps in many ways. It enhances the circulatory flow, velocity, reduces the edema, and promotes healing of venous ulcers.
Don't let death start in your legs. Take action today.